patients are increasing with diabetes. Young patients are starting to come up with diagnosed with diabetes, and nowadays you can see there is mainly the rise in number of because of mainly sedentary lifestyle, oily foods, fast foods, increased sugar and salt in the diet, such as Maggi and all increases the salt contents in the body. It causes increased number of patients.
So, what are the side effects of this hypertension?
Hypertension usually affects eyes, brain, kidneys. These are the most important vital organs which are affected. Mainly kidney diseases, eye problem, the retina is damaged usually. That later on patient can't see. Brain is damaged. Stroke risk increases. Ischemic stroke and hemorrhagic stroke, bleeding inside the brain chances increases. Heart attack risk is also increased. Because of
So, how to identify the patient is in hypertension or
the most important is regular monitoring is the only thing we can diagnose with hypertension. If the BP is too high, the patient will feel breathless or sometimes palpitation means a heart beating in his chest or dizziness, headaches. These are the main signs and symptoms you can see.
normally these days? What is the age group that young people are getting hypertension or
Uh,
elderly one?
Elderly people were getting means 20 years back. Elderly people were the more common hypertensive patients, but recently in this 10 years we can see young people means around 20 to 30 or 35. In this range also we are getting few patients with hypertension.
How we can prevent this hypertension to young
Hypertension
generation?
can be prevented by regular exercise, low fat diet, low salt intake, and meditation, like breathing exercises. Yeah, meditation can reduce the stress levels in the body, and it may help in lowering the BP, blood pressure.
As your special doctor for hypertension, so daily how many people visit to your clinic
Daily around we are
normally?
seeing many patients with hypertension. Newly diagnosed patients around two to three patients we are getting on an average per day with hypertension. So it's a very serious condition. So everyone should take care first with
Okay,
keeping in point of view with diabetes and hypertension.
okay. Salt and exercise is a major thing, Mr.
Salt, exercise, and fat.
Fat.
This is the most important components that we can take care of. And stress-free life and regular sleep and eating habits. These are the important points.
Subscribe Prudent social media channel and press bell icon for latest notifications.